My name is Dr. Christy Flick, and I'm what's called an upper cervical chiropractor, which means that I specialize in issues of the head and neck. So I'm finishing my 20th year in practice, and after having practiced in the Dallas area for that the full 20 years, I'm now in Waco, Texas, and absolutely loving it here.
Hi, I'm Dr. Becky Coates with TMJ Plus Wellness Center. My practice is located in Grapevine, Texas, right by DFW Airport. I've been in Grapevine since 2003. So my practice focuses on patients that are looking for relief of TMD, TMJ symptoms, jaw pain, headaches, poor sleep, orthodontics that is focused on airway and jaw development, and also tongue tie or frenuloplasty relief. I also have a biological and holistic practice, so I serve patients that are looking for determining root cause of other health issues that is related to the mouth and the systemic issue.
I'm so glad to be here with you. I'm talking about the spine and upper cervical is one of my favorite topics. So I really appreciate the conversation.
So, Dr. Flick, a lot of our mutual patients may have overlapping symptoms, and a lot of symptoms that I see from our TMJ patients usually come in the format of not just jaw pain, jaw clicking, or limited mouth opening, but also things such as neck pain, ringing of the ears, vertigo, obviously poor posture and poor sleep. So I was thinking that it would be really nice for our mutual patients to understand from your perspective as an upper cervical chiropractor what makes an upper cervical chiropractor different than maybe just a regular chiropractor that the public is used to hearing about.
Yes. So the biggest difference between what you would consider traditional chiropractic care and upper cervical chiropractic care is that upper cervical doctors focus on the junction between the base of the skull, C1, which is the very first bone after the skull, and then C2. And that area alone is incredibly dense in nerves and can affect head and neck in ways that can be really profound if there's a misalignment there. And that because of that area's proximity to the brainstem, if there is a misalignment there, it actually creates this chain reaction in the rest of the spine that affects a patient from head to toe. And so with upper cervical, we very specifically and very carefully evaluate that area. We put numbers on it, we measure it, we look at portions of a degree and millimeters of alignment and misalignment. And from there, affecting that area, we can actually change the function of the entire body from head to toe and really specifically are able to help issues of the head and neck, unlike traditional chiropractic care.
So, for someone who is just now becoming aware of differences of providers, could you explain a little bit more how maybe the imaging, like in our office, for example, we have a cone beam CT and we can share some photos for the user. What does that look like or how is that different? So, how would that type of imaging be different than a traditional chiropractic office?
Yes. So for a lot of our cases, we can start with plain film. And there are three films that we take that look specifically at Atlas or C1. One of them is a lateral cervical in a neutral position, just looking at the neck from the side. And from there, we gain a lot of information about the angle and the set of the very top of the spine, Atlas or C1. On top of that, there are two additional films that we need to look at to be able to see this area in three dimensions. One of them looks at the atlas from the front. That's called a nasium view. And then one of them looks at the atlas from the top, and that's called a vertex view. And with those three combined, we can see any sort of misalignment. We measure it against the patient's own skull and center of gravity, and we can see where that has shifted to the right or to the left, has turned or torqued inside of the spinal column. And then what an upper cervical chiropractor will do from there is we can measure it and assess it and figure out how to correct it. Now, with some more complicated cases, that's not quite enough. And that's where we go to the CBCT, so, or the cone beam. And from that, we can actually create a 3D model of exactly what's happening there. The CBCT has been such a game changer, as I'm sure you've seen in your own practice, where if a case is extremely complicated and there are other factors in play, we can see that maybe a bone is shaped a little bit differently, or the way that it comes across a nerve or a blood vessel can be creating some of the issues. So the CBCT allows us to do that. And then additionally, for some patients, there's also particular MRI protocols that we can do to even just see additional detail there.
I love it. It's a great explanation. Thank you for that. That leads me into thinking that a lot of patients will come to me as a TMJ office and not quite understand. In our office, we take pictures of people's posture, which is different as a dental practice. I find that is a very good educational tool for patients, and we can share some slides about that where we look at like head rotation or tilt, or if shoulders are uneven. So, as I share that type of image with the patient to get the patient to understand, hey, your jaw and your teeth are very much, everything is connected. So, maybe can you give some kind of like things to look for that just from a posture standpoint, our patients would understand, oh, like understand the connection?
Yes. Oh man, aren't they connected? I think, just kind of as an aside, I think that generally we think of our body in compartments because that's kind of how our medical system's set up. We go to the heart doctor for our heart and, the neurologist for our brain, but our bodies are systems and they all work together. So, we can't ever just look at just the TMJ or just the atlas or just the spine. It is a holistic, to get true healing, it needs to be looked at holistically. So, particularly to answer your question, particularly with the posture, there are a few things that are going to affect the TMJ more than others. And the big ones are any sort of head tilt. So this can be subtle and is hard to kind of see on yourself. Most of the time, patients will say, oh, I notice that in pictures, my head is always cocked to the side, or a spouse or loved one will notice that. And what that head tilt indicates is actually that the atlas has ridden up into the side, causing the head to tilt to the opposite direction. The other really, really big thing is head forward posture. Head forward posture is, gosh, it's an epidemic. There are many, many people walking around with head forward. What we're looking for from the side is that the whole of the ear and the shoulder should be more or less in line with one another. And as your head comes forward, it starts to create tension throughout the spine, but particularly talking about the TMJ, it begins to tighten these muscles here and the muscles along the back of the skull. And that's happening because the body is trying to balance the weight of your head as it comes forward. Every inch that the head comes forward, it basically doubles the weight of the head. And so it's not uncommon for me to see people that have an apparent head weight of 40, 50, 60. I've even seen 80 plus pounds, where that's what the body is actually holding up because the head is so far forward. And that creates all kinds of dysfunction in the system of muscles. There's actually research that even shows that it can lead to neurodegenerative diseases because of the blood flow and cerebral spinal flow to the brain. It's a pretty big deal. So that's another big thing that I see. As you mentioned, a high and low shoulder, that's another really common warning sign, indicator really, that there's something going on with the spine. And the area that affects high and low shoulder most is a little bit lower in the neck. And we'll start to get this, where one shoulder will be higher than the other. And that one people will tend to notice a little bit more about themselves. It's a little bit more obvious to see it. If a patient wants to look at their own posture, it's the best way to do it is just to get someone to help you. Hold the phone level in front of them. They're going to close their eyes, standing in kind of a neutral position. They're going to turn their head back and forth and stop right in the middle. And that's going to be the most pure neurological posture that you can get. Have your friend or loved one take that picture, and then you'll be able to see the tilting and the high and low shoulder. You want to do that from the front and from the side. And that's just an easy at-home screening tool that patients can use to even just see if there's something like that going on for them.
So another view that I'm visualizing for many of our patients as you were explaining that was the role of what I see on a CBCT, that someone's lower jaw, their mandible, as we study the TMJ, I often see that when I show the patients their posture, their spine, which you can usually see the top 5 bones at least on the CBCT, it's always interesting to me that the same tilt of the neck or rotation matches the tilt of the jaw. So I guess my clarification point would be someone who's having jaw pain, or they may notice some subtle features like their chin to one side, or maybe their eye muscles off a little bit. Do you have any thoughts on that? How the jaw being canted matches what's going on with the neck?
Yeah, so most typically on the high side will be the side that the jaw will go toward. But I would say that everybody responds just a little bit differently. So there is no like absolute on that. One really interesting thing that I will sometimes have patients do is if you tilt your own head to the side and try and touch your ear to your shoulder, you will start to feel the jaw tightening. And if you already have some dysfunction there, it's a little harder to feel it. But that tightening is basically compressing that TMJ into the tight side.
Yes. Note to our patients. See how everything starts to be connected. The other um, connected item I also see is that many people that we come into contact with, the patients will also have some sort of poor sleep. And that may come out in a subtle way, such as someone knows they snore, or they might say their loved one is the one that complains about it, or it might come into the manner of wear of teeth, like grinding because of an airway problem. So I often educate our patients that the forward neck posture epidemic that you talked about because of the looking down all the time,
Yes.
it seems that people's breathing space or airway space is not just affected by a small jaw or a tethered tongue, but the influence of the forward neck posture.
Yeah, there's a few things there. Number one, when the top of the spine is misaligned and usually they go together, you have the head forward posture. It actually pushes the nervous system into more of your sympathetic or fight or flight side. And when you're keyed up and always in that fight or flight mode, it is very difficult to get into deep healing sleep because your body's just on alert. So that is part of it. The other part is just like you were saying, the airway itself. And we can actually see on our films where as the head comes forward, the airway compresses. And so the way to reverse that is to get that head forward back, get the proper curvature in the neck that actually lifts the head and brings it up. And you were talking about devices, and that's a big thing. Like everybody can feel this if they, if they're just taking their phone and they're, kind of look down like this, you can just feel how that compresses your airway. You can't breathe as well. And of course that's going to lead to things like your sleep apnea, you're going to have the teeth grinding because your body is constantly just trying to make sure that you're not losing oxygen as you sleep. And one of the things I would say is that a lot of times now our children have a device and our children are looking down. And I've seen in my clinic where our young ones are actually not even developing the proper curvature of the spine, which is protective and helps to keep the head upright because those muscles are just never given the chance to actually do the work that they're designed for. And so when we talk about our pediatric population, oh my goodness, teach your kids not to stare down at a device. It will serve them so well over time.
I totally agree with you. I see this all the time in our practice, and I would say that that is shocking to me that young, growing adults, let's just say I have an 8-year-old and I'm working on orthodontics and I can see the spine and it's just they're already reverse curve and it is just astonishing to me. They're in the most formative years, and I would agree with you. That's a good parenting tool that we have to kind of figure out. I also said jokingly with a patient that would be the next app, but don't steal our idea, everybody. That this would not work if it was your head was down. So
Yeah.
someone would be really smart to have the app where the phone would only work if your eyes were horizontal.
Oh, that's a fantastic idea. I love it.
A good app. And I think that the other thing, because we both see not just adults, some patients out there may assume we only see adults, but we see also children. And at least in my perspective, what I would want a parent to understand would be also when you were talking about fight or flight mode.
Yeah.
I think this is an issue at home, although not really recognized. If you have jaw spine dysfunction, and let's just say we label teens, we've got hormones and attitudes and things like that. Maybe another element to this is how well are these kids sleeping
Yeah.
or with a forward neck posture to be in a amped up zone of the nervous system. And I often wonder if people's need for being on the phone all the time is that fight or flight, always have to be doing something. So that seems to be a cultural thing that's developing.
Yeah, I agree with that. And I think the thing about kids is that if they've never felt calm in their nervous system and in their body, they're not going to realize that there's actually an issue. It just feels like normal to them. And that's where we as parents need to make sure that we're, giving our kids the best tools available to make sure their spine is happy and has been taken care of. Make sure that they're building habits that are going to serve them for a lifetime, because many of us, you know, as parents, we probably didn't grow up completely digital, so we understand what that calmness, that balance between the sympathetic and parasympathetic nervous system feels like. But as a kid, if you've been amped up your whole life, like, how do you know any different there? And that's just coming at it from a structural nervous system point. You know, there's a whole other can of worms there as well.
Do you feel that what would you say to a patient that may have any type of mouth device, whether it's for TMJ or sleep apnea? And I hear this often. Once I've seen a chiropractor once or have my new orthotic, any type of mouth device, what is your recommendation for the body, the mouth, the jaw to continue to be in sync? So, what's the importance of continuing your chiropractic treatment plan?
Yes. Anything in the body is a retraining. So I think sometimes the perception is like, if you get your car tuned up, well, now your car should just run well. Well, the body is a living organism, and a better thought process around that is, if you wanted to, like, say, develop your biceps, and you're going to put yourself on a workout program for your biceps, you want to get nice big beefy arms. Well, you're not going to go to the gym once and expect that goal to have been met, right? Everybody would laugh at that idea. Well, the same is true with your spine, or when we're retraining the jaw, and the way that comes together. It is a retraining. So we have to teach the body how to work better, and specifically from the chiropractic point, alignment one time is good. Keeping that alignment is what is key. So in the upper cervical spine, we have certain ways of measuring that. We always recommend that our patients come in on a routine basis to check that. And then when we look in some of the lower parts of the neck, oftentimes I'll find that those are chronically stuck, and that does take time to get them to unstick and to begin working well the way that they're designed to.
Thank you for that explanation. I love it. Another topic that I hear every week in our practice is the question about ear ringing. So, tinnitus, however you want to pronounce it, because we hear this all the time, that the ear ringing is a high symptom. So, very
Yeah.
typical for me, a patient has gone to an ear, nose, and throat provider already and already been cleared that there's not like a rupture in the eardrum. They do not have sinus infection. And so the next question then becomes, okay, I'm going to look at my bite or my jaw. So very typical, I can find someone that they would have a bite disorder. They would have their TMJ joint. When I look on a CBCT, it's really far back towards their ear. So posterior position, and with that, they probably have a canted jaw or facial asymmetries. So I can address those points structurally in my practice, but I also educate our patients that you need to work on your spine or even your neck muscles. So for someone who's very focused on the ear ringing symptom, what could you explain an upper cervical would help with that as well?
Yes. So ear ringing is a really tough problem. Um, my policy on ear ringing in my own clinic is that we will take that case if there are other things that also need worked on in the spine. But because it is such a difficult problem, I never accept just only ear ringing patients. What we see clinically are very similar, but from the spine standpoint, we'll see the atlas having rocked to the side. We'll see generally it's a pretty good misalignment. creating tension in the brainstem. That also affects what are called cranial nerves that come out from there that are part of the dynamic when we have the tinnitus happening. Um, in my clinic, also, we do address that with something called cold laser. It's an added modality that we can use to help reduce inflammation inside of the ear, along the TMJ, and along where the atlas sits in the brainstem in the back. And those things will help about half the time. There with tinnitus, it's such a multifaceted problem. There are also diet things that need to happen, detox things that often need to happen, and that's outside of the scope of what I do in my clinic. So I also refer those patients for a more comprehensive look through someone who does something like functional medicine. It's a particularly tough symptom.
I totally agree. I do think that by and large, the public is very much about there's one issue, so there's one solution. And so that was really my focus on this question because it does take a team approach. It does take a team of professionals. I totally agree with that. And that's why I try to encourage our patients that tinnitus or ear ringing, even vertigo, there are multi factors and you can't just treat one issue. So I'm really glad that you are emphasizing that point to our patients. Is there anything that you feel like we should cover better today for sharing knowledge with patients?
Let me see. Let me take a look here. Gosh, I think that covers the things that were on my list.
Well, I think that was a tremendous explanation. I know that our patients will be very happy and thankful for this extra time that you gave us today. I know I'm appreciative. And as always, we're always looking, which is what I appreciate about you. You're always learning and growing and keep a top-notch level practice. So definitely kudos to you on that.
Well, thank you. Same goes for you. You are always out there doing the next thing, learning. It's what makes it exciting to be in practice over time, right?
Yes.
Yeah.